Hey everyone, welcome to the show. So the Inflation Reduction Act that was passed by the Biden administration, it deals in part with the high cost of prescription drugs. And the government just announced the first 10 medications that they're going to be targeting for a reduction in price. This is specifically for Medicare recipients. They say that these drugs account for $50.5 billion in spending for Americans because they fall under the Part D costs under Medicare. So they aren't covered by Medicare. So these top 10 drugs are, quote, the highest total Part D gross covered prescription drug costs. According to the Centers for Medicare and Medicaid, the 10 drugs that they're going to be negotiating are Eliquis, which is used for the prevention and treatment of blood clots, Jardiance, which is used to treat diabetes and heart failure, Xarelto, that drug is used in the prevention and treatment of blood clots as well. The next drug is Januvia. That's also for diabetes. The next drug, I believe it's pronounced Farxiga. It's Farxiga. That's also used to treat diabetes as well as heart failure and chronic kidney disease. Entresto is next on the list. It's used to treat heart failure. Number 7 is Enbrel. Enbrel is prescribed for rheumatoid arthritis, psoriasis, and psoriatic arthritis. Imbruvica is number 8. That's used for treating cancers of the blood. Next one was Stelara. That's for the treatment of psoriasis and psoriatic arthritis, as well as Crohn's disease and ulcerative colitis, again, inflammation-based diseases. And then the final drug to be negotiated is Novolog, which is also used for the treatment of diabetes. Now, unfortunately, the negotiations aren't going to end anytime soon. They're not going to even, be done by the end of this year. They're going to take place throughout the rest of this year and throughout 2024. Why it takes that long to negotiate these drug prices, I don't know. And then the new negotiated prices, they're not going to even go into effect until 2026. So you can bet your ass if a Republican wins in 2024, they're going to take the credit for this, even though they fought it every step of the way. Now, if you don't have that kind of time, in the meantime, if you don't have 3 years to wait and you'd like to reduce your risk of developing these diseases or potentially even reverse them, as I've personally witnessed others do, you can adopt a plant-based diet. And if you want to see and hear doctors who have successfully treated people for these very diseases without drugs, I highly recommend you guys can watch the documentaries called Forks Over Knives and also From Food to Freedom. I'll actually leave links below in the description box, and that way you guys can just click on them. You can check them out. You can tell Big Pharma to go F themselves. And I can leave some studies down there too, so you guys know this is scientifically based. For those who don't know, my background is as a health coach. I hosted a 2-day health conference. I had doctors. I had almost a dozen speakers over a 2-day period, most of whom were medical physicians, different types, and they all talked about patients that they have worked with they've literally reversed these diseases. I also have a friend who reversed her heart disease. Her boyfriend reversed his diabetes. They were both in their 60s at the time. That is what really prompted me. That was the impetus for me going plant-based. And I reversed my allergies, my asthma, chronic infections, chronic acne. I had cystic acne on my face, on my chest, on my back. So I know for a fact it works. But like I said, I'm going to leave some links down below for you guys so you can check it out. And again, this is science. This is not, woo-woo fairy tale stuff. So thank you all so much for watching and listening. Please like, please share, please subscribe, please become a donor if possible. Love you all. Take care. Talk with you soon.